All right, welcome everyone. Again, welcome to this week's edition of It's Worth a Shot, hosted by Mountain Pacific Quality Health. Today is February 15th, 2023, and my name is Jessie Kinsey. I'm an account manager with Mountain Pacific Quality Health. And we will be discussing vaccine updates as well as a new program, sharing out suggestions, SOS, that you may have seen come through your inbox. Next slide, please. With that, we have just a few updates as we kick off this week's session. We have recently developed some really nice resources, some state-specific vaccine calendars, as well as vaccine appointment cards. These calendars and appointment cards, if you want, if you're interested, feel free to email me and I will put my email in the chat box, and I'd be more than happy to share forward the calendars and the appointment cards. These calendars are nice because they have the 12-month calendar as well as the adult vaccine schedule on them, and the vaccine appointment cards are a dual-sided template that you could potentially use with discharge planning or maybe in another transitions of care setting, just as a reminder for when someone may be due for their next immunization. And also, we recently launched, just ahead of the Super Bowl last week, a vaccines and special teams playbook. We'll throw the link in the chat box for this one. It has quite a bit of information about immunizations from the adult immunization schedule, COVID, pneumococcal, flu, as well as some therapeutics resources highlighting a new reference that was released, a side-by-side comparison of the therapeutics that are available for COVID-19 as of today. So again, we'll drop that information in the chat box for you, and as always, don't hesitate to reach out if you're looking for something that we can help support your education needs with. All right, next slide, please. As always, a few housekeeping items. Feel free to add your webinar topics or clinician ideas into the chat, and we'll continue to meet every Wednesday. And we do have a polling question. So polling question for today: are you experiencing NHSN data entry difficulties? As some of you may have seen, we are putting together a nice 1-hour NHSN training session that will include a live demo, and I'm currently taking some feedback for questions that you would like covered in that session, and we'll also be covering it on an upcoming Worth a Shot edition. We'll just give folks a few moments to respond. All right, well, I'm glad to see that we have some folks still trickling in from the waiting room too. I'm glad to see that most say no, but again, if there's a common problem that you're seeing, feel free to drop that in chat and we can be sure to cover that on our training sessions. All right, we can go ahead and end that poll. All right, thank you guys as always for participating. All right, next slide, please. And as usual, we'll just take a quick little peek at the weekly influenza snapshot. And, positive news, fantastic news. We're continuing to see the downward trending. Overall influenza activity is low nationally. However, as I've mentioned before, just be aware of any outcroppings within your communities, counties, your state. There were, unfortunately, 9 additional pediatric deaths this last reporting period. That's up to a total of 106 pediatric flu deaths so far this season. And again, they're continuing to say the majority of the influenza viruses that they're testing are are really showing similar to the influenza viruses that are included in the seasonal flu vaccine for this year. So in a nutshell, it's still proving to be a good match. It's not too late to get your flu season for this, or flu vaccine for this season. So just a friendly reminder. And next slide, please. And a quick look at our weekly COVID-19 snapshot. And really, we're seeing a kind of a little bit of a plateau in cases in this last reporting period, decline in deaths and decline in hospitalizations. And pleased to see a little bit of an uptake in the vaccination rates, up to 15.8%. And I did want to share something with you guys really quick in regards to weekly COVID-19 tracking. So share my screen. All right. Hoping everyone can see my screen. So they just recently released a COVID-19 data tracker that's a map of vaccine coverage that you can sort by age and sex over time. And I wanted to show everyone this today as it's kind of up and coming new resource, because I found it, let it load here. Okay, so this dashboard data set, they just added this, and it's kind of neat because you can sort by female population or male population, and then also sort by age group. And what you will find, and I'll drop this link in the chat too as we go on, is that interestingly enough, or maybe not so much, the female population is much more prone to receive the COVID-19 vaccine than the male population. And as you toggle between these, it's and change those filters, you'll see that reflected on the maps on the United States. And it's taken a little bit to load, but again, very interesting for you guys out there that like to look at the data and take advantage of some of these dashboards that we have at our fingertips. Just wanted to share this new release. All right, I'll stop sharing. All right, and next slide, please. And we did have a couple questions from last week, so I will actually hand it over to our in-house pharmacist, Kyla Newland, and let her take it from here. Thanks, Kyla.
Yeah, thank you, Jesse. Hi, everybody. Can you hear me okay?
Yes, we can.
Okay. So this question came up last week, and somebody asked about oral remdesivir being available. There was a study that looked at oral remdesivir, and what the study found is that in symptomatic hospitalized patients with mild to moderate COVID and an increased risk for disease progression, which is the population that's indicated to get this medication, this oral derivative of remdesivir, VV116 as it's called, was not superior in treating COVID with respect to the time to sustain clinical recovery, but it was associated with fewer adverse events. So this is the only study that I'm aware of that's out there that did look at oral remdesivir, and at this time, it's probably not going to be moving forward, given that it wasn't shown to be better or more effective than Paxlovid. We can go to the next slide. So the other question that came up is this whole kind of a viral rebound that we can see. And folks were attributing it initially to patients who were receiving therapy with Paxlovid. But when they did a study to look at that, where they looked at this kind of viral resurgence and rebound in viral load after having Paxlovid, and also comparing that to patients that just have active COVID and are not treated with Paxlovid, they did see similar rates of this phenomenon. So at this time, the NIH treatment guidelines basically say that viral rebound and the recurrence of COVID-19 symptoms can also occur in the absence of treatment with Paxlovid, and longer treatment courses are not authorized currently by the emergency use authorization. And there's insufficient data on the efficacy of administering a second course. So at this time, it's not recommended, but there could be more data coming out. And in my resources slide, I do have another study that they did that compares Paxlovid and molnupiravir, and it compares the rates of viral rebound, and they were similar in that case as well to patients that were not receiving treatment. So hopefully that answers those questions fully. Anybody else has additional follow-up, definitely put it in the chat or feel free to speak up. So moving on, I wanted to do a couple vaccine updates. As many of you, we can go to the next slide, Mary, and actually the next slide after this. Thank you. So as many folks may have seen or heard about, the FDA did come out and say that potentially we could have an adjusted COVID vaccine dosing schedule based on what we know now, that patients who even receive 2 doses of vaccine at an extended time frame versus that initial COVID vaccine recommendations where we got 3 doses for our initial primary series. What they're saying is that 2 doses might be adequate, and that even 1 dose plus a previous exposure to this S protein might give us sufficient immunity against COVID. So the FDA came forward and said, this is what we are potentially proposing. Here's all the evidence. And the next step for this recommendation will be to go to the ACIP, which is meeting on February 22nd through the 24th. And this is on their agenda to discuss this potential update. Also included are potential recommendations for this kind of yearly booster, similar to the flu vaccine, where it would be reformulated every year. So that's another thing that will be on their agenda to discuss. And there's lots of detailed information in this report if you'd like to take a look. I have the link there. We can go to the next slide. So there was a safety signal that came out recently that you may have heard about, with an increased risk of ischemic stroke. And this is in patients that received the bivalent Pfizer booster. So they did see this in the CDC's vaccine safety data link system, which is one of the safety kind of signals that we use to track adverse events from vaccines. So it was seen in this system, but it was not seen with several other reporting systems, including the VA database, the vaccine adverse event reporting system, and also there was a study done using CMS data that revealed no increased risk. So right now this is being investigated further. This was in patients 65 and older, and this was only with the Pfizer vaccine, not with the Moderna bivalent vaccine. So more information to come, but just a heads up that this has been identified. Next slide, please. And then just wanted to touch on adult vaccines. So at least 3 out of every 4 adults are missing one of their routinely recommended vaccines. So there is definitely still room for improvement, especially after COVID. As we know, people got behind on their vaccines with the ones that require routine boosters, or potentially changes in the vaccine schedule as well, which I will talk about next. There were some changes, and the new recommendations, the adult vaccine schedule, was just published, and I believe Jesse's going to share that in chat. And I will, on the next slide, talk about which, just a few of the changes. Of course, we added COVID to that vaccine schedule, which was anticipated, of course. There were some updated recommendations for flu and pneumococcal vaccines, which we've gone over in these sessions before. The influenza updates were to preferentially recommend those, the high dose or the adjuvated flu vaccines for the older adult population. And then the new pneumococcal vaccines incorporated those new formulas that we've talked about. Also, the addition of a new vaccine available on the market for MMR and hepatitis B. So just adding those brand name products in there and the age recommendations. Some guidance on MMR. And then inactivated polio, they added some high risk situations where adolescents might consider getting that polio vaccine. And then they added, they reduced the age and indications for the guidance on shingles vaccine to extend it basically for patients that might be immunocompromised. So on the next slide is a nice QR code that will take us to the CDC Vaccine Schedules app, which I really like. I've used it on my phone quite a bit, and it's really nice because you can kind of navigate to high-risk populations instead of looking at these huge charts and trying to maneuver through. It's kind of a dynamic process to identify which vaccines folks need. So definitely get that and see if you find it useful. Somebody says, oh, Callie says she loves this app. Awesome. Was there any other questions in the chat at all?
Kyla, there was. Kathy had a question, I think maybe off of your first or second slide. She wants to know, what is the desired duration?
Of the, like, how long does it last? Or what's the desired dosing schedule? How long does it last? Yes. Okay. You know, we don't know right now. They've talked about doing that yearly, but if we see that the virus isn't mutating as frequently as it kind of has been already, and we're seeing still extended coverage with the original bivalent vaccine into these new, a lot of these new variants. So I would say the verdict is still out on that. And as far as dosing schedule, I've heard, and this is not official, but that maybe doing one dose and then doing one dose, the initial dose, and then the second dose 4 to 6 months later has been shown to be potentially as effective as the 3 dose that we originally did, where we basically did those first 2 doses really close together and then waited for the booster. So, and that's kind of what the FDA is saying with that 2-dose recommendation that they put out. So I would say we're not sure yet.
Fair enough. Thanks, Kyla.
Okay.
Thanks for asking, Kathy.
Yeah, absolutely. And as less virus is circulating, hopefully the frequency that it mutates will go down.
It sounds like Sherry also has a question. She's curious, when speaking of the bivalent and stroke investigations meeting statistical criteria, how many cases are in those questions?
You know, that's a really good question, and I don't know, but I will find the answer for you.
Thanks for asking, Sherry.
Yeah,
we'll track that down and share it next week.
Okay, we can go to the next slide. I just wanted to mention this RISE campaign. So this is something the CDC just launched not too long ago, and it's basically just trying to make sure everyone gets their routine immunizations. There's a lot of good kind of social media and public service announcement type things on their website. So go ahead and check that out and feel free to use those materials. And I'm sure they will be distributing those extensively as this campaign kind of rolls out with getting everyone up to date on their vaccines. And that might be my last slide. Oh, yeah, just wanted to mention, as I mentioned, I guess already, the Advisory Committee on Immunization Practices is having that meeting. Oh, I'm sorry, this is another event that they're hosting, but they are having the VRBPAC meeting on February 22nd through the 24th. And that is actually, and I can put that in the chat, to that is actually open to the public as well if you wanted to listen in on that. But this is reminder about this reducing pain and anxiety for folks getting vaccines. So that's another good one that you can tune into. And then we are in-house doing a NHSN training, and I believe Lori Chiquake will be doing that for us. So here is the date on that, and I think we have a link to for the registration on that now too, don't we? Okay, thank you, Miranda. So do register for that and put it on your calendar. All right. I think my last slide is just resources, and then I will turn it over to Callie. So this is the resources. Just as I mentioned, there was that study that looked at Paxlovid and molnupiravir, the rebound with each of those, and then the initial study that they did to look at Paxlovid, and then the treatment guidelines that do not recommend repeating any courses of therapeutics based on that rebound phenomenon. So Callie, it's all you.
All right. Thanks, Kyla. As she said, I am Callie Perkins. I'm one of the account managers here with Mountain Pacific. Let's go ahead and go to the next slide. We wanted to share with you guys today, and you guys may have already have seen this in your email. It's gone out twice now in the listserv. But we wanted to share that we are doing what's called, we call it the SOS, sharing out suggestions for compliance. It's an email blog. We're planning on sending it out weekly. We're considering this an extra message that we can just share out different trending citations that we're seeing, maybe deficiencies that you guys have had in our regions. We are planning on sending it out on Wednesday. And if you haven't received it or if you haven't seen it, definitely let us know. Obviously, you're not on our listserv, so make sure that you just holler and we'll get you guys added. If you guys have ideas or things that you want to see, also let us know. You guys can shoot me an email and I can plug my email into the chat as well. Let's go ahead and go to the next slide. And this is an example of our very first one that we sent out. It was on hand hygiene, and what we did is we reviewed all of the different deficiencies that you guys have seen from survey and some that have been reported to us. This one is on hand hygiene, which is an infection control deficiency. We are looking for specific deficiencies so we can give you guys some guidance on that. We also have suggestions, things that you guys have identified as best practices, and then any guidance that's pertinent to that deficiency. So this is what you guys can expect to see once a week from us. And again, if you guys have ideas or things that you would like to see, just let us know. I think next week we're going to do something on nutrition and kind of dietary issues. So watch for that. Again, the one went out today. So let us know if you guys are interested in anything specific. Just want to continue to share with you guys and get all of our resources out there. So, all right, thank you guys. Do you guys have any questions? Oh, Shay, thanks for plugging that in. Okay, I'll turn it back over to you, Jesse.
Thanks, Callie.
I see a question in chat, Jesse, from Jill. Yeah, right now the question is, does a person still need to receive their primary COVID-19 vaccination series prior to receiving the bivalent? And the answer is yes, as of this time, but I would potentially see that changing with these recommendations that we're seeing from the FDA and if the other groups concur with that. So does that answer your question?
It does. So that meets the definition also of being up to date, correct?
Correct. Yep.
At this time.
At this time. Always got to preface with that.
We're going to put it in pencil, but not in ink, maybe, huh? Yes, thank you.
Great questions. Any other questions? And we did just pop the post-presentation evaluation into the chat box. So if you have a few moments, we always appreciate folks taking time to fill that out. Let us know thoughts and feedback and if there's any program suggestions. And I also dropped into chat the immunize.org site. Kyla and I both really like this site as a resource that's kept up to date, has a wealth of information there. Feel free to check it out.
Yeah, just to add to that, Jesse, they have this Ask the Experts section, and pretty much every vaccine question I've ever had about kind of special circumstances or, altered vaccine schedules or just anything, I can usually find the answer in there. So it's a really good resource.
It's Jill again. Can I ask another question? I hate to embarrass myself, but I'm just going to do it. So is the bivalent booster, is that a different derivative? Is that vaccine made up of different components than the primary?
Yes.
Okay.
It covers the BA2 and the BA3, I believe.
Okay. Thank you.
Yeah, it's 50-50. It's basically 50% the old and 50% the new, which are not the newest circulating strains now because it's been out for a while. But yeah, it is updated from the original primary series.
Thank you.
Yeah, good question, Jill. And I do have one resource, actually, Mary, if I could screen share one more time, I'll share it with the group while we have just a couple of minutes to spare. As some of you recall, we had a center share forward a template with us that they use for keeping track of their staff fit testing and training. And this template they had laminated and put behind their name badge. And it included the facility information, the manufacturer type, the model of the N95 and the size. And they kept this behind, again, their name badge, so they knew if they went to a supply closet, then they would be able to locate the right size that they were fit tested for. And then on the opposite side of that card, they had some nice PPE reminders. So I just wanted to share, this is posted on our Mount Pacific website under our infection control tab within the nursing home section. And we will share that out forward on our listserv as well. But in case folks hadn't seen the finalized version, I know our guest speaker had shared their facilities version, but here's a generic one for folks to use as well. Again, feel free to email me if you'd like to receive a copy, or you could jump on our website in the nursing home infection control tab. All right, I'll stop sharing. Thanks, Mary. All right, well, it looks like that's all. Thank you always for taking your time out of your day to join us, and we'll look forward to being with everyone next week, same time, same place, and take care, everyone. Be well.
Bye, everybody.
Thanks, everyone.